It was probably about May of 2020 that we began asking a lot of questions about what the consequences of lockdowns and the pandemic safeguards would be and the isolation that people were going through. And now we found that when it came to opioid deaths, we reaped a whirlwind. It was very much the perfect storm for people that struggle with substance abuse. What more can we do to get out of this now that we have emerged from the pandemic, or will this stay with us? Jaimie Clayton is president and CEO of Oakland Family Services, a private nonprofit social services agency based out of Pontiac. Jaimie, good afternoon.
Hi, Guy. How are you today?
Well, you know, I hate it when we're right. You and I talked about this well over a year ago, and we said, you know, the isolation, the stress. Now we learned that 93,000 Americans died last year from overdose deaths, which is, it eclipsed the high of 72,000 that we reached the year before, a 30% increase. We hope this is temporary. Do you believe that it is?
So I think there's a few things going on here that we don't know if it's temporary. I think part of the dramatic increase is definitely about the pandemic. Substance use, isolation, really bad combination. You and I talked at length about the stress, the trauma, the mental health issues we were going to see. People who use substances being isolated, it's a perfect storm. While treatment was accessible online and there was a development of 12-step meetings online also and virtual, just not as many people access that. It's not as effective. And then, you know, there's been this huge new opportunity to use Narcan. So if you're with a group of people and someone's overdosing, there's a tool to actually save their lives. People in lockdown, we weren't using that. Unfortunately, if you read the articles that are kind of splattered everywhere, which I think caught your eye this morning, one of the biggest concerns we're seeing is the increased use of fentanyl as part of opioid use. And what we're seeing is people are not doing it intentionally. I actually just heard about a death at Michigan State of a college student who was using opioids and Xanax and didn't know that it was cut with fentanyl and overdosed. And if you read these articles and you see the data, we just saw data that came out of the Michigan Department of Health and Human Services that said the exact same thing. The actual increase we think we saw was not just pandemic related, but is related to the fact that people are not just shooting heroin when they think they are. It's cut with fentanyl. People who are taking prescription meds don't realize it's mixed with fentanyl, and for people who don't know this, fentanyl is far more lethal. It takes very little to overdose and die, and it is highly uncontrolled. So when it's being used as a filler in these other substances, people just don't know what they're getting. And a lot of times they don't know they're getting it at all. And so their normal kind of dose of what they would take to get high, or for some people just to stay not sick when you're using opioids, some of it's just to not be in withdrawal. They're overdosing because of the fentanyl piece. That's the part that I cannot tell you is going to change because of the pandemic. Yeah.
Well, but help me understand how we got here in the first place, because when we first started talking about the opioid crisis, it was fueled by prescription painkillers, people getting addicted to that. That was the gateway to heroin. Now we're talking about college students just using heroin. How did we get there? Because that's what's leaving us so vulnerable to what it's being cut with.
Well, we've actually gone full circle if you want to really think about it. When I actually was doing therapy, there was, you might recall, it was the early 2000s, well, mid-2000s, there was a string of 3 or 4 deaths out in Rochester schools of Rochester high school girls. They weren't shooting it, they were snorting heroin. It's really about the drug du jour and how cheap it is and what's available on the street. It's harder to get pills in doctor shops during lockdown, I think, is a lot of what we saw.
Right.
I don't
Are we doing a better job of keeping the painkillers controlled? I mean, you know, I can't get a prescription for you know, a 3-month supply now. I'm only getting a week's supply, things like that. Right. Are those strategies working?
I think they truly are. You and I are in the same situation. I have a terrible back, just saw my doctor, and he's like, I can give you 12 pills, and I have all kinds of hardware in my back. So these laws, the new ones, there's some actual negative side effects for people who have chronic pain and don't have a problem with addiction. But I do believe it has stopped the amount of pills you'll see out on the street. The problem is, Guy, that people who are suffering from brain disease, and that's how those of us who treat substance use see both mental health and substance use. This is not a crisis of character. This is not a person who's a bad person. It is in part a brain disease and in part behavior. You're going to find drugs. And so even though there's less access to pills, now we've gone back to the good old street stuff of heroin and cocaine and alcohol. The true problem is fixing the societal ails that lead to these mental health and substance abuse issues. And so unemployment, underemployment, poverty, and then all the trauma issues that are out there that are going on. And so really it's getting folks into treatment, getting people help is what's going to make the biggest change.
Yeah. Well, and as you said, I mean, sometimes just like with virtual learning, apparently virtual meetings may not have worked as well as in terms of delivering treatment.
Right.
There may be a lot of folks scratching their heads out there and saying, yeah, but this also coincides with the legalization of marijuana, easier availability of a drug like that. Is that also a component to this, that they use the term gateway drug? Is that exacerbating it?
It really depends on the individual. There's so much controversy about that. You can find so many studies, Guy, that tell you that for a lot of people, using marijuana is safer than alcohol. For some people who have a predisposition to addiction, any drug's a gateway drug, including marijuana. Right. I don't really believe the overdose increase that you're seeing now is at all related to that legalization. There's going to be a whole host of people that are going to tell you having access to legal marijuana helped them manage their anxiety during the pandemic. Now, I'm someone who does substance abuse treatment. I'm not really fully on board with that. But I do believe there are medical uses of marijuana. And I also do believe it being legal is more appropriate than how it's been classified as a similar type drug as heroin and cocaine in the past. Those are not what we need people to be in prison for. But again, I think the bottom line is it's all a different variation of self-medication for depression and anxiety and feeling trauma. And so many people, especially our college-age kids and high school kids, are uncomfortable feeling uncomfortable. We haven't done a great job of having people understand that, happiness is not always that easy. So there's a lot of self-medicating that goes on for that. But so much more of what we know about depression and substance use and behavioral health issues really are brain diseases that are no different than diabetes and other kinds of health problems. They start with true chemical issues that, if treated appropriately, have a much more positive outcome. That's why there's true medication-assisted programs for opioid use that are truly effective.
Right. Before I let you go, and part of this is also having organizations like Oakland Family Services helping these families dealing with these issues. You've got a big fundraiser coming up. 100 years we're celebrating at OFS.
We are, and you are a great part of that on our board, so thank you. So we are excited to have a family fun event to celebrate our 100th. This one is actually not a fundraiser as much as just an opportunity to get out and celebrate together. July 24th at Waterford Oaks, we're having a 1K walk or a 5K run. Family fun event with lots of face painting and yoga and family fun activities when the actual walk and run are over. Can register either on our Facebook page or on our webpage, www.oaklandfamilyservices.org, which is also where you can find access to mental health and substance abuse services. If you are suffering out there, there is help. You do not have to do it alone.
No, and in the meantime, for those that are engaged in it, don't think that this is a victimless thing, because they're cutting this stuff with fentanyl that can be just enough to cover Abe's beard on a penny is enough to kill several people. So I thank you so much, Jaimie. Have a wonderful event on the 24th. It's always a pleasure to talk with you.
Thanks for having me. Bye-bye.